All right, we'll go ahead and get started. So first up, just a quick overview of the agenda for this webinar. First up, like I said, my name is Wes. I'll be talking about transition tips just in general. I've been in this position now for about 2.5 years, working with folks that are transitioning out of the military or veterans transitioning from other parts of the country to Indiana. And so just like to go over a couple quick tips, things learned over time that should be helpful. Then we'll turn it over to Blaine to go over why Indiana and what InVets can do to help. And then finally, we'll talk to Chris, Abby, and Stephen about Parkview Health and learn about some of the career opportunities up in northeastern Indiana. All right, so first off, just quick 30 seconds about me. I was active duty Army, enlisted, got out in 2015. I was 11 Bravo infantry and came to Indianapolis to work on school, and at the same time ended up working for a economic development focused nonprofit. Ended up pitching the idea for InVets as a way to connect all of these employers I was working with across the state that were struggling to find veteran talent with folks that were just like myself back in 2015, transitioning and trying to make these connections. All right, so what we've learned over the past couple years, just some quick tips. The first, and this is a big one, is humility. Be humble. So, I know, like I said, from experience being an NCO in the infantry, the military tends to puff you up a little bit, right? It puts you in stressful situations. It gives you a ton of authority, a ton of responsibility at a very young age. You have to quickly adapt. You have to grow very quickly. You mature very quickly. And sometimes that can puff up your ego a little bit too much. And I think it's really important that folks, as they transition, they take a step back, they put that ego in check, and they really consider what this looks like from the other side of the equation, what this looks like from the employer's side of the equation. So the analogy I always use, if you take somebody like Elon Musk, CEO of Tesla, very driven, very smart, very hard worker. If he were to join the Army tomorrow, he might be the smartest guy in his unit. He might be the most hardworking guy in his unit, but you're not going to put him in charge. First, he's going to have to take a step back. He's going to have to learn the SOPs. He's going to have to learn how that unit operates. Now, given all of those attributes that he has, he's going to rise very quickly, right? But he's going to have to go back and learn the basics. And that's similar coming from the military to the civilian sector. While some of your technical skills will translate, your soft skills, your work ethic, your discipline are definitely going to translate. You need to be willing and humble enough to take a step back, realize what you don't know yet, and take the time to really learn that and figure it out. And that's a key thing that's important to get across to that employer as you're having those initial conversations with them. The second key tip is network. So by participating in something like this, by participating in LinkedIn actively, those are forms of networking, but I would also encourage you, to proactively try and have conversations outside of that. The reason I ended up working for that nonprofit that ultimately led me here is, I met a guy in a random social setting. He had a really interesting background, a lot of life experience, a lot of industry experience. And I asked him if I could buy him a cup of coffee sometime and just pick his brain and get his advice. Now, I did not ask him for a job at that coffee, right? It really was just to pick his brain. But, 2-3 months later, he had a position come open. He called me up and asked me if I was interested, and I came in and interviewed. And that's how most jobs happen nowadays. It's through your network. It's not from applying randomly online or anything like that. Now, fortunately, us at InVets, we can serve as an extension of your network. We can very quickly take you from who you're directly interacting with, and we can expand that network throughout the state of Indiana. But it's important that you actually grab a hold of that network and use it. The third tip is consider the employer sometimes over the initial position. So again, if you think about this from an employer's perspective, one of the key things that they're always trying to assess in new candidates is the risk factor. How much have you proven that you can do what they are about to ask you to do within their company? And sometimes that's a really easy decision. You've done exactly that thing in your previous role. However, coming out of the military, odds are you haven't done that exact thing before. So there's a little bit higher risk factor from an employer's perspective. But if it's a good employer, an employer you're willing to stick with, over the long haul. They've got a good corporate culture. You know, the pay potential, the benefits, the environment is something you would enjoy. I would recommend looking for what positions you can apply for that you are qualified for today with an eye on long-term growth. You know, prove yourself in that initial position. It'll be much easier once you've proven that you can execute that position to move within that company most of the time than it is just trying to grab that leadership position out of the gate, or you know, that highly sought after specialty right out of the gate. The fourth tip is be flexible. So again, you know, coming out of the military, you know, maybe what you did in the military directly aligns to one specific job on the civilian sector, but likely you're going to have to be flexible, and not just in position, but location. So, you know, I know a common scenario is, you know, like myself, when I got out of the military, I could have gone anywhere, right? The key considerations for us is we wanted to be within a day's drive of family members. So a day's drive, you know, a couple hours, something like that. But that gave us, you know, a decent geographic footprint to be looking for a position. If a service member comes to us and says, hey, you know, I just want a good, solid position where I can grow a solid career, provide for my family in a great community, we can work with those folks all day long. Where it starts to become challenging is where someone says, all right, I want to move to this specific town, this specific suburb. I want a specific job that meets these 7 different requirements in this exact pay range, and I don't want to commute more than 10 minutes. That's where it gets tricky. But if you have some flexibility, if you're open-minded, if you consider expanding your spectrum a little bit on what you're looking at, there are a ton of opportunities across the state of Indiana in all sorts of industries. This last tip I would add is to seek help, but own your own transition. So there are a lot of great organizations like Invest, like others, that are here to help veterans. We work with them all day long. They have a passion for helping veterans. They have great resources. They have funders that want to help veterans get through this transition process. And the biggest challenge most of them have is finding veterans that will actually leverage this network that's been built up to support them. So I'd absolutely recommend you take advantage of as many of these programs as you can. You know, absolutely work with us. We'll help you out. But there's programs like Operation Job Ready Veterans, Hire Heroes USA. There's other programs that you should leverage at the same time, because ultimately this is your transition. This is your success or failure is going to impact you the most. And so it's on you to really grab a hold of that and make sure that you're successful throughout the process. And we'd love to help you out with that. Love to point you in the right direction. But the folks that do come to us, sometimes they want to rely on us 100%. You know, they want us to write the resume. They want us to hand deliver them the job. And while we can be a huge asset, if you're not willing to take responsibility for your own transition, it can be tough. All right, so those are just kind of the quick key tips. And now I'll turn it over to Blaine to talk a little bit about the state of Indiana, what we have to offer how Invest can help.
Hey, thanks, Wes. Hey, everybody that's joining us live and watching on replay. Glad to have you. I'm Blaine Zimmerman. I'm the Director of Veteran Engagement. And like Wes, spent about 6 years on active duty as an infantryman. I split my time between Fort Bliss in Texas and Fort Drum in upstate New York. Had a couple of deployments under my belt, came back to Indiana after being on active duty and stayed in the National Guard. So I'm still in the National Guard. Took a commission last year after completing my MBA at Butler University, and I'm now an infantry officer here in the state of Indiana. So what I want to talk a little bit about today is more about our organization and the state. And I'm not going to take up too much time. I just want to give some folks some general knowledge, especially those folks that are watching from active duty bases all over the country and from out of state, so you can get a little bit more information about why Indiana is great to live in and how we can help with your transition process. So we were started in 2018. It was just Wes and Jerry, who you'll see over in the chat bar. If you have any questions, make sure you're throwing them over in that chat bar, and Jerry will be able to answer them for you. We are a 100% run veteran organization. We've got Air Force presence, Marines, and Army. We have over 150 employment partners. That number is actually closer to 200 at this point. Tons of employers in every region of the state. We have 85,000 current open positions. Now, There's a little asterisk there because that was pre-COVID, but we do want to assure people, and as I'm sure Parkview will talk about, that there are plenty of employers that are still hiring even though COVID's happening. A lot of folks are having trouble finding employees. So it's really good to still think about your job transition. There still are people hiring. So the main industry pathways here in Indiana are healthcare, logistics, manufacturing, and technology. So from a logistics and manufacturing standpoint, we're top 5 state. We have a giant healthcare industry, which we're going to talk a little bit about today. And in the technology sector, we saw an 85% job growth in 2019. We do lots of partnerships with local and national veteran service organizations. So locally, we have really great partners with the Department of Veterans Affairs, Operation Job Ready Vets, which I believe Wes mentioned. They can help you get ready for the interview. They can help you with your resume and things like that. We also partner with organizations like Team RWB and Team Rubicon, just different organizations that bring vets together to be able to give back to their community and to give them that sense again of being part of something larger than themselves. So our website was recently launched in June, sorry. So it was a really big upgrade from the last website. You can see there, that's our homepage. That little lawn right there is right outside that window behind me. So if I open that window, I can see those giant gold eagle statues. From that website, you can create your profile. And the benefit of creating a profile is at that point, you'll have access to the job board. You'll be able to upload your resume and you'll be able to apply to positions from our employer partners directly from our website. That gives you a leg up because once you've applied to that position, the hiring manager in charge of veterans at that company is going to get an email saying this veteran from InVets applied, and it will give you more visibility within the hiring life cycle. So essentially, you sign up, you create a profile, you have the ability to check out careers. Somewhere in that time frame, within the first couple of days after you've signed up, someone from my team will be reaching out to you to see how we can assist in your transition. And then you'll be able to jump on and submit your application if there's a position within the website that you see that you like. If not, we'll help you find something. Even if it's an employer outside of our network, we'll be making phone calls. We'll try to figure out a way to get your foot in the door. And then once you let us know that you've applied, we'll do everything we can to help you land that job. So the other thing that our site provides is you can look at information on specific industries. So maybe you're not real sure what the technology industry is or what different careers you can have within that industry. It's more than just developers. So you can see you could go into sales. You could be a developer. It could be data science, project management, program management, all sorts of things are within that industry. And we also break down what the median salaries are for those different career paths and stuff like that. And we'll talk a little bit more about the healthcare side here in a few minutes with Parkview Health. So you can also drill down into specific employers. Right here, you can see Allison Transmission's page. It'll show you some of their open positions and then talk about the different types of career paths within Allison Transmission, what the company culture is like, and what it's like as a veteran to work for that company. So some of the benefits of the state, kind of taking a step aside from the company, is if you're a disabled veteran here in Indiana, you can get free college tuition for your children. So that's only for state schools, but you can go to in.gov and go over to the Indiana Department of Veterans Affairs site and find out more about that program that's available to veterans so that their children, without using their GI Bill, can go to a state school with their tuition free. House Bill 1010, this has been a really big deal in the last couple of years here in Indiana. So Governor Holcomb last year signed House Bill 1010 into law, and you can see Wes in the background of that photo. And what that does is it by January 1st, 2022, military retirement pay will be tax-free from the state of Indiana moving forward. So they're taking a little bit of percentages off year over year. January 1st, 2022, your military retirement will be tax-free from the state of Indiana. So that's not federal tax, that's state tax, but it's still a pretty big chunk of money that's going back into your pocket. Another couple of benefits for Indiana, property tax deductions. So that's for our disabled veterans. Depending on what your rating is, you can get different range of property tax deductions. And then hunting and fishing licenses. So you can save on an annual or a lifetime membership with the hunting and fishing licenses. And as Jerry Young, one of my team members, likes to say, every dollar that he saves on his license means it's another dollar he gets to spend at Cabela's on gear. So let's talk about a little bit of the communities. Today we're going to be highlighting the Northeast region, which includes Fort Wayne, which is our second largest city, and we have Parkview Health, which is Fort Wayne's largest employer. One of the things about all 5 regions is they have urban, suburban, and rural living. So if you live, let's say, outside of Fort Wayne, you might have a really nice house in the suburb, really close drive to be able to get downtown to go to work, or you may want to live out in the country. There's plenty of places within a 15, 20-minute drive of Fort Wayne where you can get some acreage, still have that benefit of having a great job in the middle of the city, and you don't have that large of a commute. You can say the same thing about where we're at here in Indianapolis. A lot of different communities, whether it be suburb or rural, within a 15 to 20-minute drive. The Northwest region, it's that area that a lot of people around the state call the region. That's right outside of Chicago. A lot of manufacturing, a lot of logistics up there. The Southwest region and the Southeast region are where you're going to get a lot more of the state parks, a lot more hiking, camping, things like that. Really gorgeous area. It's about the only place in the state where you're going to find hills, and you're going to get a really good mix of that suburban and rural living in those areas. So without taking any more time, I want to be able to give Parkview as much time as they need to be able to highlight their organization. I'm really excited to hear from them. They're going to give a short presentation. It looks like we might be dealing with some technical difficulties on making sure everybody's logged in. But once we get them in, I know Abby's here. They're going to give a presentation, and then we'll have the ability for a quick Q&A at the end, and then we'll give everyone their day back. So Abby, are you on right now?
I am.
Okay, awesome. Well, I'm going to let you take it from here. Or?
Sure, yeah.
Okay.
And I know our live number is low, but maybe that's a good thing. So I see Hudson is on here, and since it's really kind of you, if you have any questions, obviously feel free to jump in at any point. I really want to be able to answer any questions you might have along the way. So yeah, I will go ahead and jump in. So I am Abby Fernandez. I am a recruiter with Parkview. My coworker, Chris Burke, he had to log out temporarily. We were having some issues, but he's also a recruiter. He is a mobile recruiter, which just basically means career fairs, college recruitment. Blaine had mentioned going around to different bases. If that's the case, Chris is the one who's out there doing that. So he's a little more out and about in the community. That's really the only difference. So, but we're really excited to partner with InVets and hopefully provide employment, or even if it's just assistance throughout the employment process, to veterans within our community and close, outside of the community even. So a little bit about Parkview. We are a not-for-profit healthcare system based in Fort Wayne. As Blaine mentioned, Fort Wayne is the second largest city in Indiana. Our 2 largest facilities do sit in Fort Wayne. We have a really large, beautiful campus on the north side of Fort Wayne that's in that picture right there. And that picture actually isn't even fully accurate. We just this summer built a second tower. So along the left side there of that picture, there's a second 6-story tower. So really beautiful campus out that way. But we have 8 community hospitals and over 100 physician offices that serve a population of more than 895,000 throughout Northeast Indiana, as well as we cover some areas in Northwest Ohio. So some stats on Parkview. As I mentioned, largest employer in Northeast Indiana, have a little over 13,000 coworkers right now, and a little over 3,000 hires last year. Obviously, those numbers are going to be very different for this year, but we are still growing, so that is still really exciting. Kind of a random fact here, but just under 10,000 employees, about 84% of our coworkers participated in our engagement survey last year. And I don't know, I don't think it's terribly common knowledge, but engagement surveys have notoriously low participation rates. And so for 84% of our coworkers who have participated in that, it's a large number, it's a good number. It means we have a really engaged workforce. That kind of ties over to that 8 years of average service for Parkview coworkers. because they're engaged, because they feel that they're being heard, their opinion matters, their opinion counts, they're sticking with us a little bit longer than average. I think the industry average right now is about 2 years. So to see 8 years is really exciting. Jumping back over to this side. So a large chunk of money spent on education reimbursement as well. We have tuition assistance, tuition reimbursement, a ton of different programs. And that's for any position within Parkview. It's not just our clinical positions. If you want to go to school for your business degree, for your accounting degree, whatever it might be, Parkview will help with that. We paid out $914,500 in coworker referral bonuses last year. How that works basically is if you work for Parkview and you send somebody our way that gets hired, you get a referral bonus, and there are different tiers for that, but paid out a good chunk of money for that too. Some awards I really wanted to make sure to mention for last year that we received. Modern Healthcare voted us one of the best places to work in healthcare. Forbes magazine, we were on the America's Best Employers list. IBM Watson Health, we were in the top 15 health systems in the US. So hiring opportunities, and this is kind of where we know that there's a disconnect on our side. As Blaine West mentioned earlier, trying to translate that military experience to a civilian position, we know that recruiters and hiring managers, we don't have that knowledge. And so something that we really want to do by partnering with InVets is understand how to translate that experience. And so on the flip side of that is when people hear that we're a healthcare system, they immediately think, I'm not a nurse, I'm not a medical assistant, I don't work in the clinical aspect, so there's probably nothing for me to do there. And that really just isn't true. There is so much. We are a business, and just like every other business, there's a lot of things that make us run. There's a lot of teams that make us run. So, but just to kind of highlight some of the hiring opportunities that we frequently see, and these are the ones, this first page is just ones that are more common that you probably immediately think of. Obviously, registered nurses. Yes, that is a large chunk of our workforce. Paramedics and EMT, that does translate actually pretty closely to, I believe, like a military medic, that type of position. We've talked about that. A medical assistant, certified nurses assistant, surgical technologist, dietitian, and then social worker / mental health tech. I feel like those are maybe some of the common ones people immediately think of when they hear of a healthcare system. But then some of the other ones I really wanted to highlight that maybe don't come to mind. So cook / sous chef. Most of our hospitals, I would say most of them have cafeterias. And then our main campus, the one that you saw the picture of earlier there on the north side of Fort Wayne, has a massive cafeteria with actually some really good food. But a lot goes into that, obviously. Line prep, the cooking piece of it, the customer service aspect, running the cash register. So just something that I feel like people don't usually think of, especially if they're coming out of like the food industry, that we do have a lot of those opportunities. Massage therapist is another one. Information systems. So IT, we have a huge IT team. We obviously need to make sure our hospitals and our doctors' offices are constantly running. So because of that, we run a first, second, and third shift for our IT teams. So Epic is the system that we use. It's the electronic medical record system that we use. It's pretty commonly known in the industry. It is a big one, but Parkview is actually certified to be able to train people on Epic, which means even outside of the Parkview system, if a hospital wants to roll out Epic, our IT team is trained to go in, implement Epic, and then train their team on how to use it. So even outside of Parkview, they're doing that. So a really large team there to look at too. There's the business and HR side of things. Obviously, Chris and I, who I think was able to rejoin us, we are under HR. We have a really large HR team. Business development, I feel like, is something people don't really think of. But I mean, as a healthcare system, we've grown in the last however many years we continue to grow. And that's part of our business development team, is looking at those opportunities in ways that we can grow. Finance and accounting is another big one, patient billing, security officer. We have police officers as well, environmental services, which is housekeeping. Again, a huge chunk of our positions, and that it really helps keep us up and running. It's a big piece of Parkview, is that housekeeping aspect. Video production, which kind of goes hand in hand with our marketing team a little bit. We do have a large marketing team. And then operations. A big one that I feel like people don't really think of with hospitals. Facilities and maintenance is huge. So again, making sure our hospitals are up and running, any issues they might have, helping out with that. Distribution, Parkview is a little bit different in that we have our own warehouse. So instead of, if one of our offices needs to order a specific I don't know, item or whatever it might be, instead of ordering from a vendor on their own, they would order that through our warehouse. And so the teams at the warehouse are responsible for making sure that we have plans with local vendors or whatever vendor it might be to make sure we're getting obviously a good price on it, the best product. So it's a little bit different that we do order through our warehouse. And because of that, we have an entire distribution team. So pickers, packers, obviously transportation of all of that stuff, and then our logistics team. Support and administration, again, is just huge. We have so many customer service opportunities within Parkview. And I mean, these opportunities are willing to look at anybody who has that customer service mindset. And so it could be front desk registration. We have a large call center. We have a call center that has about a little over 100 people that sit there. And I mean, we have data entry. So really anything within that realm, it really is a large chunk of the positions that we have here within Parkview. What the process looks like. So once you kind of figure out, or we figure out, because again, that's what Chris and I are here to do, is kind of make sense of what you're going to look at. What we would do from there is, so our talent acquisition team, there's about 25 to 28 of us, I want to say, on the talent acquisition team. What we do is, so if you apply to something or if you reach out to our talent acquisition team, Chris or I, or one of our other 25 or so team members, we reach out to you and we start the process. So that's just really kind of an informal conversation. Just, hey, what are you looking for? Not just what types of positions, but also what hours do you want to see, location, what's your pay? That's really important, is looking at pay. And then guiding you to the positions that fall within all of that criteria. And then we just kind of are a point of contact for you throughout the whole thing. So even after that initial conversation, we're just not like, okay, bye, good luck. If you don't get traction on maybe your positions, or you have questions you're not hearing from leaders, that is what we're here to do, is make sure that we keep the process moving, making sure that people feel that they have a point of contact. They're not just out there in some applicant tracking system. So we really do follow you throughout the process. But once we decide what position you're going to apply to, the manager does do an application review. Some of our positions are pretty high volume, especially when you get into those customer service type positions. They could see upwards of 60 to 70 applicants just per position. So we try to narrow that down to about the top 5 or 10 applicants that we actually send them to review at one time. From there, they decide who they want. It is in their hands at that point. So they decide who they want to move forward with in the process. What their process typically looks like is they do a phone interview, which is really beneficial in that the applicant and the manager really get to discuss, what does this position truly look like day in and day out. Any questions that the applicant might have before moving forward, they can ask then as well. But then if they both want to move forward, they do typically an in-person interview, or we are doing video interviews right now. That might change since we are lifting some of those restrictions, but I believe most of our leaders are still doing video interviews. If you get far enough in the process, and if it's allowed at this point, everything going on with COVID, some of our leaders also do peer interviews, which again is awesome because they do almost a peer interview / job shadow. So you really get to sit with them and get a feel for what they are doing day in and day out in that role to see if it's something that you would be interested in. The offer timeline varies by leader and position. Again, our high volume areas, some of those can move pretty quickly, just because it's a process that they're really used to doing. But then we do have some leaders where they really take a little bit more time to review applicants, to get that interview process going. And so I would, upwards of maybe 6 weeks or so. But again, you always have that talent acquisition connection to reach out to and say, hey, it's been a couple weeks since I've heard from anybody. Where are we at in process? Is this job still even open? Just so that kind of where everything is at. So, and then if you do get to the offer stage, after offer, background check, all of that stuff is completed, we do have a new hire orientation. We have a day-long new hire orientation, and it's a pretty cool process. It is virtual right now, I believe, still, but it's just kind of walking through who Parkview is, our mission, our goals, what our culture is like, and really just familiarizing new hires with our company. So I did want to touch on, so because of COVID, our hiring process is definitely different right now. So I think I saw in the chat, so Jerry mentioned Parkview has 429 job openings at this moment, and that's actually a low number for us. End of last year or so, we sat closer to like 800 or so jobs open. And so we have seen a little bit of a decline because of COVID. We are slowly ramping back up. And you may not see as many openings for maybe those customer service positions or housekeeping or security, IT. Those are a little limited right now. But again, what Chris and I are here to do is at least start that process. And it's what we call pipelining a candidate. So essentially just making sure we've already established that point of communication. So even though maybe right now we don't have something that fits in with what you're looking for, when that does become available, we've already got you on our list. We can immediately reach out and say, let's get the ball rolling, get you applied to it, get moving forward. So I'd just like to put that little asterisk on it, that I know right now, if you go out to our website, you may not see a lot of those positions, but we're still able to help you, still able to get at least the process started, have that initial conversation about what you're looking for, to make sure that when the time comes, we can move pretty quickly. So with that, I'm going to pass it off to Chris and hopefully Steve if they figured out their login issues. So, and they're going to go over just kind of veterans within Parkview and the culture.
All right, everybody. Well, I appreciate everybody joining us. Unfortunately, Steve is not able to join us. He's been having a few technology issues, but working on trying to get that figured out. But he's actually the intelligence commander at the 122nd. So I was hoping to go through some of these questions with him, because obviously he's lived it, right? Like, he's made the transition, and he knows what it's like. So he'd be able to speak to it a little bit better. We've had some short conversations, so I can't really speak for him, but just to talk about some of the things that we've had conversations with. So one of the things I would say, has to be the transition to Parkview from the military, from a cultural perspective. One of the big things I would say is probably the continued education that we have. He's the manager of our organizational development team, so there's constantly room for growth. And learning new things, and I guess becoming proficient within the civilian world. We give a lot of tools, in that space. The other two big things that I would say that he said he really values as far as Parkview is concerned from a cultural perspective is the teamwork aspect. For you guys, you're spending a lot of time out in the field with somebody, talking to them on a day in, day out basis. That person becomes family. And I would say that it's the same way here. Everybody's very close with each other, and, we spend a lot of time trying to figure things out, especially during COVID. People that you haven't spent time with, trying to figure out how to make things better, lean things out, implement new items, and what better place to do that, and people to do that are people like yourselves, that have that understanding of how an organization works, and just that overall family feeling. We all truly care about each other, and try to make things better, and be flexible in that space if we can. Healthcare in general is growing. You're right. Everybody needs vets. I know that everybody says that, but healthcare is definitely in that space. So why, right? Like, why healthcare specifically? Well, it's because, one, thank you everybody for being in the service, but two, because of your transitional skill sets. Abby mentioned a lot of it: logistics, accounting, IT. A lot of those skill sets that you develop in the military are transitional into the civilian world. Why wouldn't we use somebody that has a logistics background into something like our supply chain space that has a good understanding of how it works, how to keep it lean? Those things are very important, especially in the healthcare field. As everything continues to grow, we're going to need those types of skill sets on a regular basis. The other thing with healthcare is, through your service, I'm sure that there could be some physical things, some mental things, assistance in general that people might be looking for. I'm sure that the VA provides that, but having immediate access, through a healthcare system makes it a lot easier. So those reasons in general are things that I would, definitely want to consider, if I was coming into the healthcare space. But speaking to a lot of the things that Wes spoke to, and Blaine spoke to, there are a lot of opportunities, within healthcare. There are a lot of skill sets that are available to you. The transition might be tough. You have my LinkedIn. You guys are more than welcome to reach out at any time to talk and ask questions, not just as a recruiter, but as a resource. And, we're more than happy to do that. But other than that, please feel free to reach out, and, Blaine, Wes, back to you.
Hey, cool. Thanks, Chris. I had a couple questions for you and Abby. As I was listening, I was writing some stuff down. And for one, I wanted to say, from all of the webinars that we've done, your process with having that talent acquisition connection, that sounds like a kind of a separator between you and some of the other employers that we've had. So about how often do you talk to the applicants throughout the process, and how often are you in contact letting them know where things are at and how they're progressing?
Yeah, great question. Abby?
Sure. So, really kind of varies probably by applicant. And a lot of that just comes down to the preference of the applicant. So we have a really cool texting system that allows us to communicate with applicants, or really anybody. They can text in this number and you're connected to a talent acquisition consultant. Well, I'm also able to give out that number. So once we've had our conversation, I say, hey, text me here if you ever have questions or want to check in. So sometimes I get people who check in with me weekly, just wanting to kind of see where they're at in process. Sometimes I have people who maybe every couple of weeks go by. It really depends on the applicant. If I see an important update, whether it's maybe the position has been filled or maybe it's some interview feedback, we need to do some coaching, I'll reach out to them at that point. And it is a really different process. We implemented this because of the feedback we were hearing from our applicants. They were saying, I'm not really talking to anybody. I'm not hearing from anybody. I feel like I'm applying to this, applicant tracking system. And then where does that go? So Chris and I are probably newer to Parkview. About 2.5 years ago, they implemented this, and they went from a team of about 6 recruiters to, like I said, we have about 25, 30 recruiters now, where this is our sole job is talent acquisition. So it really does vary, though, to get back to your main point, depending on just what that applicant wants to see, how many updates they want, and how quickly their process moves too.
That's awesome. So one of the other things that we found in working with veterans in the transition is a lot of times they want to find ways to get in and get involved with some groups that give back to the community. So are there different community-based projects that you guys do that you bring your employees in on? Is there any type of VPTO involved or anything like that you guys provide for the employees?
I don't know what VPTO is. Can you explain that?
volunteer time off.
Okay. Chris, do you know anything? As far as VPTO, I don't think so.
Yeah, I was gonna say I don't think that we have anything as far as like the voluntary time off. I mean, Parkview doesn't like we are involved in a lot of community projects, around town, as well as like going to the schools and making those relationships, and doing what we can. But yeah, as far as like VPTO, I wouldn't say that that's something that we have available.
I don't think so. But yeah, we are definitely very involved. We have a lot of, and that is really, I mean, the great thing about Parkview is you can really do just about anything if you approach your leader and have a conversation about it. So maybe it's that there's an organization within Parkview that, or not within, outside of Parkview that you really feel passionately about. They have a day coming up where you can volunteer or do something, whatever it might be. If you go to your leader and say, I want to put a team together, could we do this on a day? They might be able to get that approved. I know we've done it within talent acquisition to do like days of caring, or we went out to one of our local food banks and helped them out with stuff. So the possibility is definitely there to even just, if you want to take initiative on your own to do that, you can do that. But then also Parkview does a lot within the community already, and we have a lot of community involvement. We even have positions for that community involvement. So yeah, definitely a lot of opportunity.
So there's basically two ways to do it. There's built-in ways to get involved with things that Parkview sponsors, and then there's other ways that if you see something, you can kind of take charge and go try to make it happen.
Absolutely, yeah.
There's a lot of power to the employees as far as choosing what they want to do and following some of the things that they feel are important to them. Absolutely.
That's awesome.
I had a quick question just about kind of geographic scope. So I know, obviously Fort Wayne is kind of the anchor of northeastern Indiana, and that's where your primary presence is. But it looks like you guys have quite an extensive network throughout the region. Can you talk a little bit about that and what the kind of ratio of openings are in Fort Wayne versus some of the more maybe rural communities?
Yeah, so I mean, as far as our geographic location goes, I mean, we're pretty much the northern half of Indiana. If you're familiar with Fort Wayne, it's going to be your Allen County, your LaGrange counties, your DeKalb counties, out into Ohio as well. We partner with some other hospitals like the Cleveland Clinic. So we have some strong partnerships there. As far as the ratio goes, I would say the majority of them right now are within Allen County. So we've recently built a 75-bed wing to our regional medical center, which is obviously taking up a lot of resources, but we're hiring a lot of nurses and support staff for that right now. So I would say the majority of the positions that you're seeing are probably going to be related to that new tower.
Okay. And that's where I would assume, in Fort Wayne would be more of the non-directly medical related positions, right? More of your admin and logistics and all of that. Could that be fair?
Yeah. Absolutely.
Yeah, our call center sits in Fort Wayne. It is right off the highway though, so I do know I've worked with people who are willing to commute in from surrounding communities, because it's not a terrible drive right off the highway, but definitely a lot of those do sit in Fort Wayne. And I would say as you get to like our community hospitals or a PPG, so PPG is Parkview Physician Group. So if you ever see that's what that means. It's either a family medicine or specialty office. But especially as you get outside of Fort Wayne, they're smaller offices. They have less staff, and you're not going to see as many, especially like logistics, housekeeping, those type of things outside of Fort Wayne.
Okay.
Well, we really appreciate you guys coming on and explaining, especially the side of healthcare that's not doctors and nurses. So I think that's one of the things that there's a disconnect, not only in the regular community, but especially with veterans coming out. Obviously, if they were a medic, and maybe it makes sense, but a lot of people don't realize that you guys hire everything from doctors to high school grads. And that there are a lot of open positions available, and especially with you guys with over 400 and counting right now.
Yep.
So, like I said, everybody, thank you so much for coming on. Sorry about the technical difficulties today. Unfortunately, those things happen, especially right now in the webinar heavy life that we all live.
Sure.
So this will be sent out to everyone in our social networks as well. And so this will, have a little bit of a tail to it as well. But really appreciate everybody that came on live. Abby and Chris, really appreciate you guys taking the time. We're excited to have you guys on as partners. And if anybody has any questions, you can reach out to any of us. I know Jerry shared everybody's LinkedIn in the chat. My email is blaine, BLAINE @invets.org. And if you haven't already, go on invets.org and create a profile, and you'll be hearing from us very soon.
Yep, and you can check out Parkview's profile in there as well.
And I just really quickly wanted to say, I know Chris had mentioned, obviously, even outside of positions within Parkview, always feel free to reach out to us. Chris and I both come out of agency staffing. And so we have a lot of connections within the community that even if it's outside of Parkview, we're happy to get you connected with maybe whether it's a different agency or just another employer that we know is hiring. We're happy to help out in whatever way we can. So
absolutely. We appreciate you guys' service all day long.
Awesome. Thank you guys so much, and have a great rest of your week.
Thank you guys.
Thanks, guys.
Bye.
Bye.